Hey everybody, Nightwalker here. Just wanted to talk to you a little bit today about mental illness. There was something specific that happened today where a lady drove into the ocean with her children in the van. And I know I've spoken about it quite a few different times on the page, but I figured it's about time I do a video on it. Mental illness is not something that we need to be afraid of. We gotta lose the stigma and start treating people that do have mental illness not as a person with a mental illness, but as a person. They are people. There's a lot of things that people don't understand about mental illness, and hopefully maybe I can help clear some of that up. First off, the medications that they put people on that have mental illnesses, depending on the illness, yes, it helps, but not always. And the side effects of most of those medicines are really hard to tolerate. Now, you take a condition such as schizophrenia. A lot of schizophrenics will get on medicines and they can make them have tics, they can make them not be able to sleep. There's tons of side effects. Now, I grew up, my stepfather had schizophrenia. Now, schizophrenia has been proven that there's a abnormality in the brain. There's a couple different hypotheses about where it comes from, whether it's an increase of dopamine or whatever be the cause. The ventricles in the brain end up becoming larger, and obviously you take away parts of the brain, you're going to have abnormalities. Now, they get put on medications and they begin to feel normal again. If they have hallucinations, those hallucinations may go away. So when they're on the medicines and they're interacting with you just like you and I would be, you would never tell that they have a condition. But unfortunately what happens is their body adjusts to those medicines and they don't go back to the doctor, and you know what, I'm feeling normal, why should I go back? Or I'm healed. Unfortunately, there is no healing from schizophrenia. This goes on with a lot of different psychological conditions. Depression being one of them, manic depression. You have multiple forms of depression. But people get on medicine, say, you know what, I feel better, and then they just take themselves off of it without even consulting their doctor, which unfortunately doesn't work well. A lot of these medicines you got to titrate down from. But the point is, nobody wants to be classified as that guy with the mental condition. I've fought through my own mental issues, or I keep saying mental. I really would prefer to say psychological issues. I'll use them interchangeably, don't get angry at me. But when I went through my problems, I had to get on a medicine in order to balance myself enough to be able to work myself through them. Unfortunately, a lot of people are afraid to go ask for help because there's a stigma that comes along with it. If my doctor writes the wrong thing and I go for a federal job and they, for whatever reason, are able to obtain my medical records, who knows, maybe they'll say no to me based on something I've been treated for in the past. Maybe Johnny will know what my medication is for and see that I'm picking it up or something, and oh, look at that psycho over there. Well, you know what? Such a large majority of our population has psychological issues, and they are afraid to get help and speak out about them because they're afraid of the way that society's going to view them. Obviously, you all know that I preach that we need to change the way society thinks, the way that we view things. We have to start reaching out to people who have psychological issues and let them know, you know what, we're not going to judge you any differently. We're not going to treat you any differently because your brain decides to act differently, whether it be due to genetic issues or chemical issues or whatever be the case. People are people. They're not people with mental conditions. And I mean, A comment I heard earlier was that somebody was afraid to speak out, and when they finally did, somebody told them, you know what, you just got to deal with it. And you know what? Yes, you do have to deal with it. There's an extent to where you have to say, you know what, I have this condition, and I'm going to deal with it by speaking out, by going and getting the help that I need, by educating those around me about it. I shouldn't have to hear people say, you know what, I have no one to talk to. Because each and every one of you, each and every person has either family, friends, co-workers, or even me on the page to talk to. This is one of the things that I really strive for in doing this page, is that I want people to have an outlet. You don't have to go home and hide all your troubles within you until you finally can't take them anymore. That's how we end up with cases of suicide and worse. Everybody has their breaking point, and what I want you to do is to reach out and get some help before that breaking point gets hit. And in order for you to feel comfortable doing that, in order for your mother, your brother, your friend to feel comfortable reaching out, we have to make it to where it's more acceptable to reach out. We got to get rid of that whole concept of, oh, people that are depressed are just weak. No, that is not the case. We got to get rid of the concept of, oh, you know what, that person has schizophrenia. You don't want to talk to them, they're weird. But you know what, they're not. They have a different way of thinking. Each person that you interact with on a day-to-day basis could have an underlying issue, and you don't even know. What difference would it make if you did? If you found out that that friend of yours that you've known for 10 years, if they don't take their medicine, hears voices or sees things, are you going to look at that person any differently? Now, to go on a little bit more about this, look at the homeless population that we have. Do you realize that not all of those homeless people are alcoholics and drug addicts that carved their own path? A lot of them are psychiatric patients that can't get help, don't even realize they need help. And what do? They go live their own existence in the woods or under a boardwalk. Occasionally somebody will call an ambulance for them because they're acting strange, so they'll get taken to the hospital and either get forced to get help, or depending on the overloading of the hospitals, be kicked right back out. We're not doing what we need for these people. We're not doing what we need for our veterans that are coming home with PTSD. That's a relatively new and concept, and it's becoming more and more understood by a lot of people, but still there is a large part of society that looks at PTSD as something, oh, you just have to get over. You don't just get over PTSD. Been there, done that. It's not fun. We have a lot of growth to do as a population, as a society. It is 2014, for crying out loud, and people are still afraid to say that they need help. These are some of the things that we're going to start working on. These are the things that we're going to start putting into each other's heads and changing in this society. We can't keep going the way we're going. There's no reason that people are shut out and not able to get the help that they need because they're afraid that someone like you or I are going to respond negatively. We need to start working together and start getting this point across. If you hear somebody saying and talking negatively about people with psychiatric conditions, step in, shut them up. That is just the beginning of what we need to do. If you think somebody, or you hear somebody judging other people, you know, one of the greatest comments I heard lately was, I don't care why people, or that people are talking about me. I want to know why they're comfortable talking about me in front of you. I take that to heart. That means to me, why is that person comfortable speaking to you, saying that psychiatric conditions are just fine, or that they're crazy, or that people are weak, or anything to the negative aspect of it. I think it makes no sense, and it's something that we need to start putting our foot down. So you hear somebody picking on somebody or talking about them behind their back, it's your duty to shut them up. It may not have been before now, but you know what? Now that I pointed it out, it is. You all have that responsibility. Educate them. Send them over to my video. I'm going to have many more coming up on this topic because it's just way too much to put into one video. I know I'm rambling a bit at you, but I just wanted to touch base on it today. As always, thank you for coming over to the page. Thank you for coming to my YouTube. Please hit that subscribe button. Throw me a like, maybe a comment. I'll always try to get back to everybody that comments with any kind of questions or topics that you're willing to discuss. Everybody, please be safe out there and visit back daily. You know, I'm here. I'm not going anywhere anytime soon. All right, y'all. It's time for a new society. It's time to go nocturnal.